Dr. Janet Ekpeyong, Director General, Cross River State Primary Healthcare Development Agency from Abuja. Thank you for joining us on News Across Nigeria.
Thank you very much. Good afternoon.
Good afternoon to you. Now, states are going to be playing a major role in the rollout as outlined by the DG of the NPHCDA. What are the provisions made by states for transport, storage, and personnel for the rollout?
Okay. So once again, let me congratulate the federal government for taking delivery of this vaccine. I mean, after 368 days since we recorded the first case of COVID-19 in the country, at least finally we have the vaccines here. And of course, the important thing right now is distribution of these vaccines to the various states. So at this point, it's actually expected that each state should have a very functional cold chain system because at the state level, you're going to be receiving these vaccines. Cross River State not spared. We're going to receive this vaccine at the state, and of course, we have to plan to make sure that they get to all the local governments, of course, all the facilities in the state. But before the arrival of the vaccine, what we are doing currently is to see how we can build capacity of health workers. Currently, we have support from NPHCDA, where we're trying to build the state team first, who will now be do a dissemination of the same training to health workers at the various LGA. And once that is done, at least we are sure that they will be able to manage the vaccine, ensure its potency when they are brought to the state at the various cold chain facilities and all that. And then after that, we'll now receive these vaccines at, in our various states and ensure that they are stored in the right temperature. And even when they'll be transported, ensure that we strengthen our push system where we take these vaccines from the state capital to the various LGAs. So currently, that's what a lot of states are trying to do, to see that at least their cold chain equipment are top-notch. Although a lot of states have challenges in terms of enough storage facility, considering the fact that some states had issues with the NSAS protest and they have not recovered because of the number of facilities that were affected. Although some facilities have already been fixed, but a lot more still needs to be repaired and fixed. And so that this is where the federal government needs to also come in to support several states to ensure that at least they can strengthen their cold chain system before these vaccines are sent to the various states.
Indeed. Now, knowing the controversies that trailed the early stages of the pandemic in Cross River State, what are you doing to combat possible vaccine apathy? Firstly, is there vaccine apathy in Cross River State and the theories making the rounds?
Oh, yeah, I think it's not just in Cross River State because even when COVID came, there was a lot of hesitancy. Whether is it true? Is COVID-19 real? And I must say up to now, people still have such notion. So in Cross River State, yes, there's been a whole lot of vaccine hesitancy. And we are not relenting. We are trying to ensure that we get our people really sensitized on the importance of taking up these vaccines. At least the good thing is that we're able to convince them at least that COVID do exist. And the same way, we're also able to convince our people to accept other vaccines that have helped to eradicate so many diseases. For instance, we no longer have polio. It's because of the acceptance of the vaccines that were available. So that's the same strategy we hope to apply here. We'll continue to sensitize our people, continue to work with key stakeholders, continue to leverage on several organizations and bodies. For instance, the religious bodies, the traditional rulers, platforms and other women organizations, so many organizations, including the media, to ensure that our people are sensitized. And of course, even those in the communities, we are working with the chiefs in all those communities. And of course, the town criers giving out all the necessary information at this moment so that there will be that huge demand for these vaccines. The good thing is that we have the vaccine. And so it's now for them to accept the vaccines and let's see how we can end COVID in Nigeria once and for all.
And now we know that it's good to lead by example. Strategic leaders at the national level are expected to take the vaccines in public just to assuage the populace. Is there any plan for maybe the governor and other leaders in the states to take the vaccines in public?
Oh, yes. It's very important that our leaders, of course, take the vaccine so that at least there will be that confidence for other people to do same. His Excellency has shown interest in ensuring that he takes the vaccine. And, of course, the Deputy Governor and other key government officials, including even the traditional rulers, some of them have shown interest that they are actually going to take this vaccine so that our people know that the vaccines are totally safe. And, of course, myself and the Commissioner, we're also going to be taking the vaccine. And I want our people to know that it's totally safe and for them to also take the vaccine. So, yes, our leaders will surely take the vaccines.
Yes, we're certainly expecting you to lead the charge with the governor as well in taking it in public.
Yeah.
Thank you so much. Dr. Janet Ekpeyong, Director General, Cross River State Primary Healthcare Development Agency, for coming on News Across Nigeria.